Parents often ask, when is it time to consider an out-of-home therapeutic placement for my child? It's an incredibly difficult decision and one that should be thoroughly evaluated by parents and the team of clinical professionals that are supporting them. Many parents might consider therapeutic placement if their child is struggling with behaviors that they've had difficulty with in other environments, such as individual therapy, family therapy, or other outpatient therapeutic programs. A therapeutic placement may be considered if your child is struggling with ongoing or persistent substance abuse or other addiction-related behaviors such as gambling, gaming, pornography addiction, or eating disorders. Adolescents who self-harm or who have had a history of suicidal ideation or suicide attempts. Kids who struggle with pervasive depression and/or anxiety where treatment has not been successful in a less restrictive environment. And then kids who are continuing to exhibit oppositional behaviors, disrespect to parents in the home or authority figures in the community, kids who are struggling with ongoing aggressive behaviors both in the home and outside of the home, and kids who threaten to run away or who have run away. These may all be indicators that some kind of a placement may be warranted. Each of these behaviors alone does not warrant therapeutic placement in a program. It's really important to evaluate what's going on with your child, listen to the clinical professionals that you're working with, and also as a parent to trust your gut instinct in knowing that what's going on in the community, what's going on in your home is not providing enough support for your child. Looking at the intensity of the behaviors, the frequency and the duration of the behaviors is also an important factor to consider. And above all else, if you're concerned about the safety of your child and not being able to manage your child's safety while at home, it may be important to consider placement. It may be helpful to look at consulting with an educational or therapeutic placement consultant who knows the breadth and scope of programs both regionally and nationally and can help match your child to a program that's going to best meet their needs.